Ayesha Akhtar with the Epilepsy Foundation of Greater Chicago. The person that I wanted to bring to talk about infantile spasms is Dr. John Millichap. He is an attending physician at the Lurie Children's Hospital in the Neurology and Epilepsy Center, as well as an associate professor of pediatrics and neurology at the Northwestern Feinberg School of Medicine. And also, he is our current chair of our Medical Advisory Council. So Dr. Millichap, welcome.
Thank you.
So I just wanted to have you start with just a very, high-level definition of what infantile spasms are. There are over 20 types of epilepsies and syndromes, and I know that this is one of the rare ones.
Yeah, and maybe I'll back up before talking about infantile spasms specifically. As you mentioned, there are multiple, 20 plus epilepsy syndromes that we might diagnose in a child. And when we're approached by a family with concern for seizures, our first thought is, listening carefully and determining that it is in fact a seizure, and because it can be other things as well. And the next thing that we'll do is listen carefully about the patient's development, about their life up to that point, their medical history, any family history. Then we'll examine the child carefully, and then we might get a certain number of tests, such as an EEG or electroencephalogram, where we put the little wires on the outside of the scalp and record the electrical activity from the brain, or a picture of the brain, usually an MRI. With that information, we can determine what type of epilepsy, in some cases, that child might be having. Now, diagnosing childhood epilepsy is quite different from diagnosing adult epilepsy. We have some very simple clues that I've been taught to use in my training and experience. We can look at the age of onset of the seizures. So typically look at sort of neonatal onset, so in the first month of life, sort of childhood onset or infantile onset, the first couple of years of life, and then adolescence, and then older. And we also look at the EEG activity. Is it normal in between the seizures? Is it normal but then has some specific patterns associated with it? And with those characteristics, we can narrow down the epilepsy syndrome. So the epilepsy syndrome that you want to talk about today is infantile spasms, also known as West syndrome, named after a doctor in England in the 19th century whose child unfortunately had this condition, and he wrote a letter to one of the medical journals about his child, and so it was named after him and his child who suffered from it. So typically these children will present to the pediatrician with concerns for little movements, and we call them spasms because that's what they look like. So the child will typically have clusters of these spasms as they're falling asleep or as they're waking up, and they look a bit like they're being squeezed in their face. They'll kind of have a tensing of their face. They'll put their neck forward, their arms and shoulders will go forward, and if you could see my hips, you'll see my legs will be coming up as well. So sort of like the baby crunches. So this is about a 6-month-old baby. And parents and doctors will look at it and go, that looks like the baby's uncomfortable. The baby will often be crying in between. And they might think, oh, it's something they ate, or they have colic, which is much more common than infantile spasms. So sometimes the diagnosis is a bit delayed because people aren't thinking of infantile spasms. But lately, parents will come with their child to the hospital more quickly than before, because they'll put it into a search engine on the internet, baby spasms, and almost right away the search engines will take them to images and information about infantile spasms, and they'll bring that to their general doctor, who will then send them speeding to the emergency room or to the neurologist for evaluation. So a few times we'll see patients who are having colic and not having infantile spasms, but we'd like to see those patients because we don't want to miss anybody who might be having seizures. So typically, the patients will, as I said, be infants, as the name implies. The usual age of onset is around 4 months to 7 months, most typically around 6 months. Along with the onset of these spasms, which will gradually increase in severity, become more forceful and more frequent if they're not recognized initially. They will also have maybe developmental issues. So we call it developmental regression in the medical world. But I'll often hear the parents say that their 6-month-old infant just lost that twinkle in their eye. They're not quite focusing on them. They're not quite making that connection when they're changing the diaper or feeding. And that's the first clue that worries the parents. And then the third part of the diagnosis of infantile spasms is the EEG. So if we hear about developmental regression that sound or look like infantile spasms, we'll do an EEG, as I mentioned before, the brainwave test. And even in between those clusters, we'll start to see changes that are abnormal. And it's quite an unmistakable pattern. We even use the term chaotic, meaning the brain waves are all kind of jumbled up, and there's a cacophony of activity that will immediately cinch the diagnosis of infantile spasms. We'll try to record the clusters of spasms, but it's not essential with a good cell phone video or description from the parents to make the diagnosis. Some patients are born, unfortunately, with issues. They either have a known genetic issue. You may have heard of Down syndrome is one of the most common genetic conditions, and that is a risk factor for developing infantile spasms. Or they may have had an issue in the shortly after birth. They may have not got enough oxygen to the brain. They may have been in the hospital right after birth and had seizures back then, different type of seizures, and been on medication. And those patients will leave the neonatal intensive care unit or the nursery and have developmental issues. And when they see their neurologist, the neurologist will be warning them beforehand, watch out, you might see these little crunches. Those might be this type of epilepsy, this infantile spasm. So that's one group of patients. And then the other group of patients is those who have no health problems at all, otherwise developing normally, and then at 6 months suddenly start having these seizures. And when those patients come to our attention, we'll do the EEG and the MRI, as I mentioned, but we'll also do a great number of blood tests, genetic tests, in addition, to help determine what the underlying cause is. And I mentioned these two causes of infantile spasms, or these two major groups of etiologies or causes, as we call it, because it means a lot for the long-term outcome. So, if a child has Down syndrome or had not had enough oxygen at birth, they're probably going to have some challenges as far as development, whether they have infantile spasms or not. And this other group of patients who don't have any known cause may have, it's sort of unknown how their development will be. And we find that in both cases, the earlier we diagnose infantile spasms and give the effective treatments, the better the developmental outcome is. But in the case of those that we find no cause, there are a small proportion of patients who will go on to lick this epilepsy and have a relatively normal development or normal development growing up. So there's a lot of hope there when we first meet a family where the child has no pre-existing condition and a new diagnosis of infantile spasms. So.
Wow, that is a lot of good information. And I have actually some follow-up questions, but what is that average time from the initial visit with your clinic to making that diagnosis?
Sure. So actually, it should take no time at all. We do a lot of work at our hospital and other hospitals across the nation and the world to make this a speedy diagnosis. So there are advocacy groups and parent groups. The Epilepsy Foundation is also a part of this effort to increase awareness among doctors and the public about infantile spasms, so they know that there is an urgency to the diagnosis and get the treatment started. Really, if most neurologists hear about a suspicious or a suspected infantile spasm, they are directed to the emergency department, where they will be admitted to most hospitals for EEG and further evaluation. At some centers, they might be able to get a speedy EEG done outside the hospital or in the clinic area, and that should be done within a day or two. And we'll see that abnormality on the EEG even in between these clusters of spasms, which will cinch the diagnosis and lead to the initiation of treatment. Almost everybody has a cell phone these days, and will have it on them at all times. So the clusters will typically last, around 5 minutes or longer. So you can usually start up the video and catch at least a couple of spasms in a cluster to bring with you to the doctor's office to make them see what your baby is doing periodically is very, very similar to the videos of infantile spasms on the internet, and heighten their suspicion and urgency of evaluation. That sleep EEG, they won't be able to ignore the abnormality there, and it will really make the diagnosis. So if you're a parent and you feel like something is wrong and it might be infantile spasms, don't stop until you've had an EEG on your baby while they're asleep.
So let's turn now to treatment options. So can you talk a little bit about the treatment protocols? So someone has come into your clinic and they've received the diagnosis. What is that process like?
Sure. Well, we'll most often be meeting them for the first time in the hospital. So we've had the EEG done. We're potentially had the MRI done. We've already ruled out certain underlying causes, or we already know what the cause is of the infantile spasms, and the treatment is the same. So I counsel families that unfortunately their baby is suffering from one of the most severe early onset epilepsies that we know of. But the good news is that for the next month or so, I know exactly what to do. We have 2 FDA-approved treatments for infantile spasms, and there are, unlike most other new diagnoses of epilepsy of other types or diagnosis of epilepsy in adults, they don't have a clear treatment plan. In the case of infantile spasms, we do. So I try to give parents that sense of calm and at least certainty about what the next steps are after the diagnosis of infantile spasms. The earlier we treat with effective medications, the better potential outcome. And I have to emphasize, because the treatments that are FDA approved do have certain side effects or potential for side effects that are greater than some of the other treatments for epilepsy or some of the other treatments for other diseases that parents may have heard of at that point. One treatment is an injectable steroid or a hormone which makes the body make its own steroids. Without getting even into too many specifics, this will have the potential side effects of steroids, so might make the baby irritable or extra hungry or not want to sleep a lot, which are, anybody who's raised a child knows that those are not things you want to exaggerate in a 6-month-old, certainly. But this is, perhaps a necessary evil and a short period of time where they would need to endure this treatment. It's only a month treatment recommended by the FDA with this medication. And the second FDA-approved medication is an oral medication. It's a liquid that can be taken by mouth by the baby, given twice a day as well. And this medicine will calm the birth and has been shown to be effective for the treatment of infantile spasms as well. Now, the studies that have been done, we know that if we give one of these medications, we don't give it very long to work, maybe 2 weeks, and if it's not cutting it, it's not doing it for that child, then we'll quickly add the second one. And many experts will actually give both medications very early on in the treatment to maximize the potential for a good outcome.
And how does a parent know that there is hope for their child?
Sure. So, as I mentioned earlier, there's, hope for all children that they're going to respond to the treatments. There is this piece of the underlying etiology. We'll do, if we don't already know what the cause is because of a pre-existing condition, we will do genetic testing. We will do additional imaging and other tests to help determine what that cause is. And really, it's that underlying cause that determines the long-term developmental outcome. But we know that even in kids who have a pre-existing condition or do have a diagnosis that we find, the earlier effective treatment leads to a better developmental outcome. We've known this since the 60s when we first started using these treatments. And the best case scenario for infantile spasms is a baby with no pre-existing condition comes in with the infantile spasms. We catch it within a few days of it starting because the parents noticed something wasn't right. We give one or both of the FDA approved treatments. The spasms stop within a month. The EEG becomes normal. And we'll continue to follow these kids, looking out for developmental concerns. They may have mild learning disabilities or other subtle findings going on, but many will go on to be perfectly normal, or a few, I should say. A small proportion will go on to be perfectly normal. That's the best case scenario. But even if we have an underlying cause identified, if the patients respond to the treatment initially, we can also be very hopeful that epilepsy won't be a large part of their life going forward. But I will also caution that many patients, almost a quarter or more, will not respond to those first treatments that I mentioned, and will need additional treatments that may or may not control all of the seizures, and there may be ongoing developmental concerns, which their neurologist and epileptologist will certainly guide them through all of those worries and different scenarios.
We have started a support group for caregivers because we know that something like this can be very taxing on the parents, the caregivers. So we know that epilepsy is something that not only affects the immediate child or the person, but also the loved ones around them. So it's definitely a team effort for sure.
Yes, it is. Any illness in a child is certainly devastating and concerning to all. But in the case of infantile spasms, if the parents are not, grief-stricken and maybe crying as I'm giving the diagnosis, I know that it's not having that impact. They're not realizing how serious the situation is.
Right.
And I think our hospital and others really do recognize this and will offer support all along the way after they're diagnosed and start their treatments.
I just wanted to thank you again for being with me this afternoon. I personally learned a lot about infantile spasms. I hope our audience did as well.
Thank you, you too.